Hello. Today is going to talk about the tubing safety culture care. This part is provided by the Department of Nursing and Center for Quality Management. So about the care, we first want to know what kinds of tubing slippage will happen. So there will be a couple of them. The first is tracheostomy tube, nasogastric tube, central venous catheter, and also other drainage tubes. And there's two patterns of tubing slippage. So the first one, these are all called unplanned extubation, and it's divided into two. The first one is deliberate self-extubation. The second one is accidental extubation. So for unplanned extubation events, there are a couple of causes that can be found. So the first is about physiological and behavioral factors, like vomiting, cough, pull out of the NG tube, and sometimes there's medical care factors, caregiver factors, communication problems, and also other relevant factors we'll have. For the caregiver factor, the percentage is about 9%, which is quite important in preventing these unplanned extubation events. And what will happen after these tubage slippage? So there can be, like if it's an NG tube, there will be aspiration pneumonia, prolonged hospital stay, or more medical costs will increase. So it's very important for the medical staff, the patients, and also the caregivers to all understand the importance of the tubing and to prevent their slippage. So for the most common reasons and causes for unplanned extubation, there are 7 listed in this slide. You can see that sometimes the patient is confused or delirium, so he or she doesn't know what's going on. The second one is the patient did not intensively want to pull out the tube, but maybe it's just unintentional, so it's just moving around and then the tube sort of like slip off. But sometimes they don't understand the importance of placing the tube. The third reason is sometimes the tube is not adequately fixed. So if the tube, the tape fixing the tube is loose or wet, sometimes it will slip off. The fourth one is the patient refused to be constrained, and the straps are breaking down or taken off. So at the same time, it's very hard to control them to not move out the tube. The fifth reason is the patient feels discomfort. So there's some tubing, there's a foreign body effect, and some foreign body feelings in the throat. So this makes the patient uncomfortable, and they want to take out the tube, or maybe sometimes by vomiting, it will cause the tube to slippage. The sixth one is there's no good communication, so actually the patient is not clear why the tubing has to be put or must keep in that position. And the seventh one is sometimes the caregiver is distracted, so they go to other places or they just lose their attention, and then suddenly the tube slip off. So we need to recognize what kind of patient is the most high-risk group. So if for the two different patterns, we have the first one here, deliberate self-extubation. Sometimes the patient is confused or delirium. Sometimes the tubing is making the patient really uncomfortable. So they sometimes just let it slip off. The second one is accidental extubation, which sometimes the patient forgot they have a tube, or sometimes there's some activities when moving around will cause the tube to slip off. And another reason may be that the tube is not really fixed solidly, so it can move around, or sometimes just unintentionally pulling around may cause the tube to slip off. So we need to know what kind of activities will have a more high-risk condition for the tube to slip off. So when we're doing these kind of activities, we want to make sure that everything is safe and you make sure that the tubing has no problems. So the first one actually is get on and off the bed. The second one is changing positions or postures, or bathing, taking baths, changing their clothes, oral hygiene, doing these kind of manuments actually will have a change. The third one is a wrong restraint process. So the restraint or constraint didn't do it really good, or sometimes you move out the restraint, and then the tubing maybe accidentally fall off. So that has to be very careful. And sometimes we, when we're resting or just sleeping, so sometimes these times tubing may accidentally fall off or slippage. The fifth reason is sometimes when we want to temporarily release the restraint from the patient, so the patient wants them to have a freer moving motions, sometimes forgot to restrain it back, sometimes will cause the tube to slip off. And also if the fixation of the tubing is not good, that sometimes will cause problems. So when we're carrying up the tubing, this is very important. There's some precautions we have to make sure. So the first one is we need to confirm that the tubing is fixed and placed in the suitable places, and avoid any possibility of pulling or slipping off or displacement. So very important, effective fixation of the tubing is very important, and we don't want improper tube or tape slippage issues to happen. And has to be very careful when we're changing positions, which when we're moving or we're getting off the bed, and we have the need to take attention, especially about the tubings when we're doing these kind of movements. When the patient is delirium or agitated or confused, we have to make sure there's appropriate restraint, and we have to take care that the patient won't take out the tube accidentally. And the patient under restraint will also need a call bell when they need some help or assistance. They can use that to call for help and to notify the nurse. Before our caregivers are leaving the patient alone, we have to make sure that the restraint is very firmly attached and adequately placed, so the patient will not accidentally take off the tube. For the fifth one, when the patient is restrained, has to make sure that the restraint process and method is correct. And we don't want the restraint to causing any injury of the hand or any part of the body, which will give a pain, and otherwise it will make the patient uncomfortable. And we also need to give the patient mental support and encouragement. So let them understand why we need these tubings, why that will help them, and decrease the risk of deliberate self-extubation. So, and also we have to observe whether the fixation, the tapes are keep at an adequate condition, and not whether or not loose. And if you find anything strange or anything not in the correct position, please tell the nurse immediately. And for the eighth one, if accidentally you found out that, wow, the tubing has fall off, then you have to tell the medical staff immediately and let them to manage it. Do not push back the tubing, and that will cause very dangerous issues. So next we'll talk about protection restriction. So accidental extubation will happen if the patient is confused or delirium or agitated. So sometimes we need to restrain the patient a more adequate way. So the very important part is you need to confirm that the wrist is 20 centimeters away from the tubing. So, and that part is far away, so the hand will not go over there to pull out the tube. So you can see in the photograph right here. So restraint, every time you have to make sure that the position and the distance is at a correct way. So this is talking about the tubing safety care. So there's a QR code which you can scan it and you can see the courses on the line. So we have to know that prevent unplanned extubation needs everybody's help, especially yours. Thank you.